Technology and AI are becoming more and more integrated within modern medicine, and one of the most notable changes is wearable health technology. From smartwatches to heart rate monitors to rings like the Oura Ring, we now have devices that are able to track your heart rate, your temperature, your heart rate variability, and sleep patterns all in real time. So as an ER doctor, here's my take. So I used the Whoop strap for over a year because my sleep patterns were so disrupted from shift work, and I wanted real quantifiable data that could help me prioritize rest and recovery. And the Whoop strap was good in giving me metrics like sleep debt and recovery scores because those were actionable data points. However, the biggest downside to current health technology is that most of them operate on a subscription model, and the subscription was quite pricey for this, and the strap was starting to irritate my skin and give me a rash. So ultimately, I stopped using it. One of the most useful data points that patients will sometimes come into the ER with is a rhythm strip that's produced by their smartwatch. For example, sometimes people with Apple Watches will come into the ER saying that they have an irregular rhythm called atrial fibrillation that their watch detected. And honestly, when we compare it to a 12-lead ECG that we perform in the ER, it's usually spot on. And the added benefit is that the watch is able to detect and timestamp when the patient had this irregular rhythm, telling us exactly when it started and how long the patient was in the rhythm for. And sometimes we will actually use that data to guide management, whether we decide to sedate and shock or cardiovert a patient back into their normal rhythm, or just treat them with blood thinners. As time goes on, wearable technology will probably just keep getting better and better. It'll become more comfortable, more accurate, and be more empowering for people to manage their health more proactively. But my biggest concern is that all that data is going to be owned by private companies, and their ultimate end game is not your health, it's your money. And just like we're seeing in the controversy of 23andMe, where they're actively selling off people's private genetic information without consent, we don't know how all that health data is going to be used or sold off for a profit in the future. I'm going to be posting a few more videos on how technology and AI are being integrated into healthcare. So if you found this helpful or interesting, continue to follow along.